Thanks, Natalie. It's a great opportunity to speak today and to talk to you about what I do and why, I suppose, I do it. So yes, I've been in business. I tried to update that bio, but it didn't go through. But in about 18 years now, so been working as a natural therapist. I was a chef, as you heard, and working in restaurants. And one day I came home and said to my wife, I want to do something different. I want to be a nurse. And she said, no. My wife's a nurse. She said, one nurse is enough. So she said, what do you... I said, I want to make a difference, primarily, more than helping people enjoy their meal, and I want to make a difference in people's lives. So we hit on eventually massage therapy. So I trained in massage therapy and then found Bowen therapy along the way. So I've established Geelong, Bowen and Remedial Therapies. We've now been in our premises for about 8 years there after working from a home-based business. So I've developed a business now. We have 5 other therapists in the building, and basically the reason what we do is to inspire happy and healthy lives, and that's our mantra, if you like. So the people that we bring into the business to operate their business from within our walls, they aspire to our values and pick up on our mission, if you like. So what do? I thought I'd probably tell you a little bit different about it. We start from very early on treating people with Bowen therapy, and I'm going to talk primarily about Bowen therapy today. So we can help people right at the start of life, even for women who are trying to become pregnant, perhaps this day and age. If you go along to a GP and you say, I'm not having trouble getting pregnant, they might say, well, give it another 12 months, maybe they've just come off a contraceptive pill or something like that. Quite often people will fall pregnant once they stop trying, perhaps, or once those stress levels can be reduced, or once they're about to go on IVF. Not always, but sometimes Bowen therapy can certainly help with people trying to fall pregnant in a number of ways. And we'll talk about the how later, perhaps. But I was recently watching a conference presentation by one of our Bowen therapists. She's a gynae obstetrician from America, and she's using Bowen therapy to help turn babies in late pregnancy that are breech presentation, which is very difficult and often results in a caesarean, for women who don't want to have a caesarean or are really high risk at caesarean. So doing simple Bowen therapy, very gentle work, can often get these babies to flip. So she's being contacted by other doctors in her practice over there in America and midwives saying, we've got a breech presentation, can you work on this person? And she's keeping some really good stats and getting some great results. Very, very gentle, getting these babies to turn and have a normal delivery. So that's where we start. And often late in pregnancy, women often have difficulty perhaps or discomfort. So if we can help them live a happier life through later in their pregnancy, through having less pain, we can certainly do that. Another area we help is babies. Colic in babies is really often a common thing. If you sort of say to someone, we can help with colic, they say, I wish I'd known you 5 years ago or 10 years ago, This is a really cute baby, but at 3 a.m, when it's screaming its head off and no one's had some sleep for a couple of weeks, everybody's distressed. The baby's really distressed, and so are the parents. Bowen therapy can be very effective, and there's been a recent study done in Bulgaria, and it was really shown to be very, very effective in helping babies with colic, and sometimes just what the doctor might call an unsettled and unhappy baby. And I think sometimes the mothers might say, well, you take him home for a night and you see how you go. Because they say he'll get better. Bowen has been very effective, very gentle work on them, and it can make a big difference. I recently had a little one come in, I spoke about a few weeks ago, who was projectile vomiting and wouldn't turn his head away from the right side at all. After 2 treatments, after the first treatment he didn't vomit anymore, and then after the second treatment he was turning his head and looking straight up as they walked in the pram, and would certainly turn around and was starting to look at the mother. She was very, very happy. Another one, if we have happy babies, we often have happy mothers who get to enjoy their babies in those first early weeks and early months, which is fantastic. Another quick story, I had a lady who delivered, and she rang me after 6 weeks after she gave birth, and she said, Chris, can you help? She said, I haven't been able to go to the toilet since I gave birth. So she wasn't able to urinate. She had to catheterise, every time she wanted to go. She said, my husband's on night shift, I've got to catheterise, my baby's crying because it wants a feed, and now I've got a UTI, I'm at the end of my tether. Can you help? And I said, let's see. Some very gentle work with Bowen therapy. She said, I hope I wet my pants on the way home. I said, be careful what you wish for. She rang me about 20 minutes later and said, you wouldn't believe it, I just got in the door and I've gone for the first time in 6 weeks and she didn't have another problem. That muscle was obviously locked closed. It wouldn't, through the trauma of the birth. So, some very gentle work can be very, very effective sometimes to get the body to reset itself, if you like. So, that's a great story. Another thing we do is we help young blokes go and have sleepovers with their mates. If they're a bedwetter, they're going to be really apprehensive about doing that. They can't go on school camp. Bedwetting reacts very, very well to some very gentle work with Bowen therapy. We're getting some great results with it. So it's another great referral for us. And if you can get a couple of blokes together to go and have a sleepover for a weekend where one of them is no longer anxious, am I going to wet the bed? Or what's my friend going to say about me? It can really help him live a much healthier and healthier life early on, right from the start. We're talking a lot about poos and wees today, but another great thing that we can often help is constipation in children. It's the number one presentation reason at Geelong Hospital in the paediatric ward, constipation. It costs a fortune in health costs. One of the senior paed nurses there, Mauro Morganti, did a research study as part of his Bowen therapy training and found that Bowen therapy was incredibly effective in helping kids who are suffering from constipation. Therefore, if you can keep a child out of hospital, it saves saves his family and him a lot of distress, but also saves the state a fortune. So, helping kids with constipation is it's amazing how it can work sometimes. They can put everything down the front and everything up the back, and nothing seems to be working. Some very gentle work with Bowen can make a big difference, and often they can just go. And it sometimes can be a chronic problem, but we can certainly alleviate a lot of those symptoms. So it's great. Something else we do is help students. Students that are stressed don't do well in exams. They're too much up in here. There's too much going on. I had a little bloke coming at the moment. He's coming for bedwetting. So after 3 sessions, he's had 3 dry nights. He's absolutely stoked. He's only a little bloke, but he's an absolute terrier. Like, he just, almost rips the place apart when he comes in. So he's a real goer. But this week he got Student of the Week. His teacher recognised, not only having any therapy, recognised that he was thinking and concentrating so much better. He actually got Student of the Week in the class. He's absolutely stoked, and so are his parents. But he's also not wetting the bed every night. So we've got a couple of benefits there. Very gentle work. I can't read that. 3 minutes. Thank you. So concentration and stress. Another one is certainly would help athletes. And often these athletes are children, or they might even be professional athletes. So in conjunction with Bowen therapy, whether that be reducing stress levels or just helping them get ready for events or even injury, and in conjunction with the mild hyperbaric oxygen chamber we've got in the clinic, Bowen and the hyperbaric can be very, very effective for helping with athletes as well. Another area are people who work in the corporate world or sit at desks or use computers. A lot of the people that you work with, perhaps, or even yourselves or employees. If people have headaches or back pain or neck pain, they're not very productive. I had a young girl come in last week and she said, I've had a migraine for 8 weeks. I said, do you mean a bit of a headache? She said, the doctor says it's a migraine. I've had it every day for 8 weeks. She's actually a nurse. She came back this week and I said, how are we travelling? I'm thinking she might have said, oh, it's dropped. She said, I haven't had a headache since I left you last week. Absolutely fantastic. She said, I was thinking about not coming back, but I thought, I didn't want to jinx it, so I've come back anyway. So it's great when you help people like that. This bloke, Nathan, is going to get a sore back. Definitely. So back pain is as Nathan said, is a real scourge on the community. But soft tissue therapy can sometimes be very effective in chronic back pain as well. So for workers who, as I said, he will get a sore back. He's guaranteed to walk into one of our clinics. So Bowen therapy can be very effective with work-related injuries as well. Something else we're seeing is assisting people who are going through chemotherapy to help them with their symptoms of the chemotherapy. We're finding people that are having the Bowen just prior to a big dose of chemo seems to help them get through, and they notice it when they don't have it. So it's anecdotal at the moment, but certainly helping people with chronic illnesses and getting through. The elderly also, a lot of people go to the doctors and the doctor says, well, you're getting old, you just have to expect to get pain. And that's really unfortunate. Bowen therapy, once again, gentle. I can help really elderly, unwell people, because it's so gentle, with helping with their chronic pain, whether it be back pain or whether it's from sitting too long, or it might be a chronic condition like Parkinson's, so we can help with some of those symptoms. So this is where we are in Arthur Street in Belmont, and a number of the ways that we actually do this, and I'm going to be very quick here as I'm running out of time, it's me doing hands-on treatment. It's me teaching Bowen therapy. I teach locally, internationally, and interstate. And in the Diploma and Certificate for Bowen therapy, there's my current group of Singaporean students. And I'm also president of the Bowen Association, have been for 15 years. And so I have an opportunity to sort of talk to government and also have a really strong association. I'm now also being asked to chair the Bowen Training Australia, which is an RTO which teaches Bowen therapy in Australia and across Asia. And I produced the Bowen Buzz, taken straight away from the Nova Buzz. I took the word, when you've got a mentor, you use what works. So I produced the Bowen Buzz podcast, telling people in the world about Bowen therapy. And I also run a Bowen therapy Facebook group and administer that. I'm going to finish up in 2 slides. Bowen therapy increases vagal tone. It takes you from this to this. If we can reduce stress levels, it helps so many things. And I'm just going to skip right through and say that we can help all of these people. These are my dream cream, bread and butter, whatever you want to call them, put them all into one big pot. I can help any person in the community, or I'd like to talk to any person in the community and maybe be able to help them. Thanks very much.